Okay, class, we're going to do a tissue review, right? We spoke about four types of tissue. We said there was epithelium, connective tissue, muscle tissue, and nerve tissue. Those are the four types of tissues. So let's look at what we've seen show up on some past quizzes before. All right, so it's kind of like a drag and drop, right? We have to choose between connective tissue, epithelium, muscle, and nervous tissue. So blank is a network of specialized cells that monitors the internal and the external environment and initiates commands through which the body reacts. Well, that's your neurology, that's the nervous system. What type of tissue is classified by the number of cells and the shape? Well, that's going to be our epithelium. When we talk about skeletal, cardiac, and smooth, we know that falls under muscle tissue. Blank is widely distributed through the body to allow for movement of the skeleton. Movement of the skeleton is muscle tissue, specifically skeletal muscle, right? Which is the most diverse and abundant type of tissue that's widely distributed through the body? That's our connective tissue. Which one lines the body cavities? It forms the surface layer of the body, makes up glands like mammary glands, sweat glands, lines the hollow organs. That's also epithelium. And which type is made up of neurons and neuroglial cells or glial cells? Again, that's nervous tissue or neural tissue. Okay, drag and drop. So we have to choose between liquid connective tissue or fluid, supporting, and connective tissue proper. So supporting, remember, is bones and cartilage. We have three types of cartilage: hyaline, elastic, and fibro. Compact bone, you should be thinking osteon. And then we think of the osteoblast, the osteoclast, the osteocyte. Remember those? And lacuna and canaliculi. Those are the things that come up with compact bone. When I think of fluid connective tissue, I think of blood and lymph. With blood, we have red blood cells, white blood cells, and platelets. Areolar, with connective tissue proper, we have areolar, adipose, and reticular. And then we have our dense regular, dense irregular, and dense elastic. Those fall under connective tissue proper. Again, drag and drop, main categories: epithelial, connective, nervous, and muscle. Let's knock out muscle first. We know smooth muscle and cardiac muscle fall under muscle tissue. Nothing better than using the word in the definition. Nervous tissue is nervous. Under epithelium, these are named by the number of how many layers of cells. Is it simple or is it stratified? And then the shape. Is it squamous? Is it columnar? Is it cuboidal? And then don't forget we have pseudo stratified. And then connective tissue is areolar, it's fat, elastic cartilage, compact bone, hyaline cartilage, all falls under connective tissue. Again, so now we're looking at the three different types of cartilage. Fibrocartilage, which is the strongest cartilage in the body, we find it with the intervertebral discs, the pubic symphysis, and the medial lateral meniscus of the knee. Strong cartilage, remember we said it's made up of thick, parallel collagen, whereas hyaline is just thin bundle of collagen. So it's not as strong. So it can easily break down with degenerative joint disease, but it's found at the end of bone. It's found separating the two parts of the nose, the nasal septum. We can find it around the trachea. They're called tracheal rings. And the cartilage, the thyroid cartilage, is also another example of hyaline. In terms of elastic, which is flexible, parts of the ear, the epiglottis, which is the flap at the back of your throat. It's not the uvula. Don't confuse it with that little a punching bag that you see hanging from the hard palate at the back of the throat. The epiglottis is that flap that when you're eating, it closes off the windpipe so that when you swallow food, it diverts the food down the esophagus, not the windpipe. Okay? And the eustachian tube. These are all parts of the elastic cartilage. Okay, let's take a break here.